And so what is a high dose here, and how are you administering it?
Yeah, so a high dose was 15 mgs per kg in the mice. I know a lot of people are kind of constantly asking me this question about like, well, what does that mean? And how did you decide this dose? And how does that translate? And, it's complicated because we took a lot of time to decide, how to set up this treatment protocol.
Hmm.
And in part was based on a lot of different, many factors, but in part on what's being done in clinical trials with high dose.
Yeah.
We're kind of looking at high doses of being administered to patients that as kind of a starting point for thinking about dosing. But another consideration that we had to factor in is that we do know a lot about the pharmacokinetics in mice versus humans and the metabolism of mice versus humans. So mice
Right.
have
Right.
much higher metabolism. They can eliminate psilocybin like 4 times faster than humans. So we took all of these factors into consideration and came up with this dose. So again, I know people are always asking like, well, what does this dose
Right.
translate?
Right.
It's not that simple.
Right.
There's a lot of factors that you need to think about when directly translating.
Yeah, yeah. For those listening, like what we're getting at here is I've done a podcast with people like Jeffrey West before, and metabolism doesn't scale linearly with body size. So it's not just straightforward like this animal's 10 times smaller, so you get 1/10 the dose. It's a little bit more complicated than that. And basically, mice have a much higher metabolism than we do, and so you
Yes.
have to take that into careful consideration when thinking about the dose. But 15 mg per kg, this would correspond to a hallucinogenic dose. I don't know if that would be a heroic dose in a human, if you did the math, but it would be a psychedelic dose.
Absolutely. Yeah. Yeah. And that's what we were going for because I think most, at least from what I know, most of the clinical trial data that's out there, for the most part has, or at least more than microdosing, we know more about the high dose
Hmm.
psychedelic dose.
Hmm.
There have been more clinical studies with the high dose. So I wanted to start with that just because from a clinical standpoint, we know more about that.
Yeah. Oh, sorry. Final question, and this is an important one before we get to the result here. What would be the average number of months that such a mouse would be expected to die?
Yeah, so mice tend to have their median survival is around 30 months. And so, anywhere in that vicinity. And so we expected that this would be approximately a year-long study.
Because
So,
you're starting at 19, I think you said, and then you know that you're going to go roughly that long.
right, yeah.
Okay, so psilocybin versus vehicle. What did you see?
Yeah, and so we treat by oral gavage, which is basically orally treating the mice. And yeah, so we initially we saw that again because we've tagged these mice have tags. We are literally monitoring each individual mouse on an almost daily basis, and we started seeing it right away, very early on. We started seeing that the mice just seemed to look better. They seemed healthier, and I don't know exactly how to quantify that, except for that it's something that all of us in the lab seem to notice right away.
Yeah,
Um,
you have a picture in the paper, and it doesn't take a trained expert to see that there's a difference here. Like
yeah,
the fur is shinier,